The first step is understanding if your vasculitis is well controlled. Most women can have successful pregnancies if they plan to become pregnant when their disease is well controlled. Vasculitis is a broad term, and there are different types. Deciding if one type of vasculitis is active may look different from how we determine activity of other types. Stay tuned for videos describing how we assess activity in different types of vasculitis. ANCA-associated vasculitis causes inflammation that targets small blood vessels. Signs of active disease traditionally include inflammation of the kidneys, lungs, and sinuses. Pregnancy complications occur because the small vessels that penetrate the placenta are responsible for delivering blood and nutrients to the developing fetus. If these vessels are inflamed, they are unable to function properly and cause complications. Polyarteritis nodosa is a vasculitis that causes inflammation of medium-sized blood vessels. Signs of active disease include high blood pressure, abdominal pain, and skin rash. The medium-sized vessels responsible for circulating blood to the placenta cannot function properly if they are inflamed, leading to complications. Behçet's can present with oral and genital ulcerations, occasional eye inflammation, and other symptoms. Women with Behçet's disease can develop blood clots. If you have a history of blood clots, your doctor may recommend blood thinners. Possible complications during pregnancy include worsening eye inflammation, oral and genital ulcerations. Behçet's disease causes inflammation that impacts the function of blood vessels that penetrate the placenta. If these blood vessels are inflamed, they cannot function properly, and this compromises blood flow, which can result in complications. Takayasu arteritis is a vasculitis that can cause high blood pressure, kidney dysfunction, aneurysms, and heart failure. Work with your doctors to evaluate how all of your blood vessels are functioning. It is important to have healthy blood flow to decrease risk of complications during pregnancy. Here's a list of doctors that may be involved in your care prior to, during, and after pregnancy. You should be evaluated by your rheumatologist at least once per trimester. Their role is to assess how active your vasculitis is. We recommend every woman with vasculitis be evaluated by a maternal fetal medicine doctor, which is an OBGYN with extra training to take care of women with medical illnesses. Also, if you see other specialists in the management of your vasculitis, we recommend discussing the plan for pregnancy with them as well.